Hello, everyone, and welcome to the Health Equity Chats podcast. So, in this episode, we are highlighting diversity in health in equity and wellness by discussing various health topics that are covered in the month of February. So, February marks American Heart Month, which is where we raise awareness about heart health, encourage heart disease prevention, and support research. And really, when we discuss heart health in general, it's important to talk statistics, especially with how they apply to folks and their communities. So, according to the Centers for Disease Control, heart disease continues to be a leading cause of death in the United States across various ethnic groups for both men and women. And it's really important to note that heart disease does impact the population on a disproportionate level, which is why, for our podcast for today, we will be highlighting different heart health resources. I am Grissel Oliveros, a health educator here at the Southern Nevada Health District in the Health Equity Program, where we focus on helping folks get their highest level of health. And today we are joined by some really great guest stars from the Federally Qualified Health Center, as well as from the American Heart Association. So I will let our registered dietitian take it away first and introduce herself.
Well, thank you very much. So I'm Caitlin Parker. I like to go by Cat. I am a registered dietitian over with the Southern Nevada Community Health Center. We're a federally qualified health center, so we help provide care to the whole Southern Nevada area, no matter the means of which to pay. Or insurance coverage, because we want to make sure that our community is healthy. And I help be a part of that by teaching about some of what is health. I know it's such a big topic.
Okay, thank you so much, Kat, and happy to have you here to speak about nutrition and really how important it is to heart health. And also joining us today, we have representatives from the American Heart Association, so I will let the ladies take it away and introduce themselves.
Hi, I'm Nichole Monzon. I'm the Community Impact Director for the American Heart Association for Nevada. I am based out of Southern Nevada, but I cover the whole state. And we work with community organizations, clinical organizations in their work across hypertension, high blood pressure, nutrition, readiness, things like CPR, and those types of things. Happy to be here.
And my name is Iris Martinez. I'm currently interning with the American Heart Association underneath Nichole, doing community impact work. So that means program implementation, being out and about with the community, trying to engage with the community, and seeing where us as a part of the American Heart Association can best support everyone at the community.
Thank you so much, Nichole and Iris. It's a pleasure having you on to the podcast for today. And then before we move on to kind of the meat and potatoes of our show, I'd also like to give a quick recap from our previous podcast. So we do have two available discussing mental health and the different services available for folks around the Las Vegas Valley, as well as our Hispanic Heritage podcast, which discusses the social determinants of health. And both can be found on our official Southern Nevada Health District YouTube channel or our Health Equity page, which is found at southernnevadahealthdistrict.org/healthequity. And then really kind of in the same vein of mental health, we do have some excellent mental health resources that are available for the community. And I'd like to highlight one, which is a free resource, which is Credible Mind. So Credible Mind is an online platform that provides health resources in an easy to access digital format. So really for our folks in the go, Credible Mind is a great resource. So the platform fosters a sense of empowerment by using a holistic approach to mental health. And services through the platform are available 24/7, and they are completely confidential. So please see www.crediblemindcom to learn more. And to jump into the meat and potatoes, so for our first heart health question for the day, I'd like to pose this to both Kat and the American Heart Association team. So really, can you tell me what is heart disease?
Ooh, yes. Heart disease is a broad collection of different types of conditions, as well as other things that can affect the heart overall, as well as the brain, because the blood goes everywhere. The heart's pumping the blood to everywhere. It affects the different areas through the arteries and veins. And so if we're, let's say, having high blood pressure, that can potentially start causing us issues along the road, and maybe even increasing risks of things like stroke or hurting our kidneys, because again, the blood's going everywhere. And so if the heart's working hard and pushing against those organs like that, it can cause issues. But there's also specific things like our coronary artery disease.
Mm-hmm.
There is things like our things like heart failure, high blood pressure. I know you guys can probably touch on a few more as well.
Yeah, when people say heart disease, like you said, it can mean a broad spectrum of things. It's anything having to do with your cardiovascular system. So anything to do with your blood vessels. So it could be talking about atherosclerosis. It can be talking about blockages. It could be talking about, there might be something with your heart that is not quite right, and so it's not pumping properly. And so while you don't really need to know exactly what, is going on when you say that somebody has a heart condition or cardiovascular disease, you need to know that they are at higher risk for things like heart attacks, heart failure, stroke, things like that.
Yeah.
I think what I would also want to add with heart disease is it can be both acute, so it happens in an instant, or chronic. Through time, it just builds up. Like atherosclerosis, it's just when plaque builds up. It takes time for that plaque to build up. So don't think of it as just heart attack in the moment. As long as it's affecting your heart, then I would say it would be classified as heart disease.
Yeah, absolutely.
Absolutely. Thank you guys for your input for that. And then what might be some other heart issues that are covered kind of under the term heart disease? I know we were discussing arteriosclerosis, but maybe arrhythmias, would that also be covered under the term heart disease?
Yeah, absolutely. You could even have things like what we call more clinically like congenital heart defects. So things that just your heart was born a little bit different. And so that can, if it's affecting the way that the heart works, just because it was, whether it's something that has to do with the electrical bits of the heart, so the tempo, so that arrhythmia, how it beats, or whether it's something to do with the actual way that the organ is able to pump the blood. Either of those can fall under some of the things that are just things that happen when you were born.
Yeah, absolutely. And I know we were discussing heart disease, kind of after the disease has already developed, but what might be some risk factors that go into developing heart disease?
There's a number of risk factors. A lot of them, like you said, you might be born with. So there might be, different things going on with your heart where it's not developed the same as maybe somebody else's heart. You might have risk factors in your family. So if you know that heart disease has been prevalent in your family, things like high cholesterol, high blood pressure, diabetes, kidney disease, all those things, all those contribute because your body works as a system. Like you said, your blood is flowing throughout your entire body, supporting all the systems. And being able to kind of know your family history is really important, and asking about things. I know in a lot of families, people don't like to talk about what is wrong with them, or if they're having, problems and, don't know where to go, or going to the doctor, things like that, but it's really important to ask. I will say that even if you do have a history of heart disease or high blood pressure, high cholesterol, diabetes, things in your family, that's not the end-all be-all. There are so many different things that you can do to kind of balance out those high risks. So you might have, maybe instance of young people in your family having, like I said, stroke or heart issues. So if you know that means you have to take extra good care of yourself. So nutrition is very important. Physical activity, sleeping, stress management, all those things can help mitigate those risks that maybe, like you said, are, kind of part of your genes, part of things that you're born with.
Absolutely. Or even things like if we're smoking. So that's not even just the regular tobacco cigarettes. So that we have a lot of newer forms, things like vaping, e-cigarettes, that are also very harmful because it's, one, you're inhaling smoke, but also two, it's from the tobacco itself. So it's sometimes people think, well, I'm vaping, so it's healthier. No, unfortunately not. Or even excessive uses of alcohol, like too much. And nutrition, you'll hear it time and again. We're shooting for moderation, and so that includes even when we're out partying sometimes or having holiday gatherings. We sometimes tying an extra one on is not going to be beneficial for you, even though it may seem like it's a good idea in the moment.
Right, thank you guys. And then what might people be able to do to kind of lessen their risk of heart disease, such as maybe incorporating more physical activity?
Absolutely. I mean, we recommend, and by we, I mean, these are national guidelines. The imperial we. We recommend getting something like 2.5 hours of moderate to vigorous physical activity. And so what that means is something that gets you sweating, something that gets that heart going. I mean, it's an organ, it's a muscle, just like anything else. You got to exercise it, you got to help build it up. So we know that getting that kind of exercise helps with the your heart health, as well as it's good for mental health. There's a lot of good studies about how just getting in movement in the day, you get those good endorphins going whenever you start lifting weights or going calming the brain down with and the body down with things like yoga or meditation. All of those are really good, as well as getting things like a balanced diet. That is something that's very important, whether it's using something like MyPlate, another big we recommendation about how we is good practice for people to eat, because we know when people follow things like the plate, which is just our general guidelines for everyone, it's there to help prevent some of the things that can lead up to heart disease. So it's there to help lower some of the amounts of sodium we get, which can help with some of our blood pressure. It helps lower some of the saturated fat that we can get, which helps reduce some of the risk for things like high cholesterol or some of that plaque formation that we were talking about. There's a lot of good benefits there from just from diet and exercise alone.
Absolutely, definitely agree. And ladies, how important is it to address heart disease risks?
I think it's super important because there is a lot you can do to bring that risk down. One of the things that we talk about a lot in the community and with the community organizations that we work with is educating people so that they have the information that they need, so that when they do go see a provider, they can ask the right questions, they can bring in information about their lifestyle, things like that. A key thing you can do in terms of prevention and just kind of being aware of your risk factors is knowing your numbers. And so when you go in for a checkup, knowing what your blood pressure is and understanding what those numbers mean, knowing, your cholesterol numbers, and again, what those mean and kind of how that relates to your heart disease risk. Other numbers that are really important, A1C numbers, so diabetes, blood sugar, things like that. And then really looking at, the things that you eat and understanding what is low sodium, what is high sodium,
absolutely.
like what are those kind of like thresholds. And I will say that some of these, can vary from person to person. My normal resting heart rate is a little bit different than everybody else's in this room, but there is general guidelines where we can kind of fit in and say this is a healthy level, or this is a level where, you should have, recommendations of getting more exercises, maybe losing some weight, and then always knowing those big risk factors that we have total control over, things like the alcohol use, tobacco use, and things like that.
Well, thank you, ladies. And then kind of within that same avenue of risk factors, what might be some barriers to care that might increase risk factors?
Well, within some of the Southern Nevada area, I know some of the big ones can sometimes be transportation, just getting around. Other ones can be things like where and you're getting your access to food, if you have access to food. Food insecurity, or not having good access to food because of food deserts, which some things we'll talk about. Those can really be big barriers in your nutritional health. And they can unfortunately cause sometimes more problems than solutions.
Absolutely. And Kat, would you be able to maybe give us a definition of a food desert and maybe some statistics as well?
Absolutely, I can do that for you. So there's a lot of definitions because it's something that we study. So of course, when we get into science, sometimes we like to, everyone's got to put, colloquially, everyone's got to put their hand on their ball and have their own definition about what it means. But in a broad sense, we can say that a food desert is a part of a community that lacks immediate access to fresh foods. And when that happens, that can lead to something like food insecurity, which is where we're uncertain or maybe or are limited to the access of food, where it may not be enough to live an active and healthy life. Just within Nevada alone, in the southern Nevada area, we know that 1 out of 7 people are food insecure, and that 1 out of 5 children live in food insecure households. Both of those numbers have gone up in the past year, which is really unfortunate to hear because of rising prices, inflation. There's a lot of factors that can contribute to it. Even with high enrollments in food stamps or the SNAP program, or Supplemental Nutrition Assistance Program. We even know that there's 32 food deserts just within the Las Vegas metropolitan area. So we are unfortunately sitting in a community that doesn't always provide the best environment for us to be able to make some good choices, and can sometimes be a barrier, because out of those 32 food deserts, 17 of them are have high concentrations of people that don't have access to vehicles to really be able to get around within a mile to get to another grocery store. Even things like having sometimes other chronic conditions that maybe keep us in bed or we're not able to drive, that all kind of contributes to it, which is why some of those factors can really, like I said, they might all seem small individually, but they all add up very fast.
Absolutely. It all compounds together, and it really does sometimes increase your risk for that. And then, Kat, and for American Heart Ladies, what might be some resources that folks can use to maybe access some nutritional food?
I would recommend going to the Get Healthy Clark County. You can get direct access to finding different resources around the community, whether that's a medical resource, whether it's a food pantry, a hot meal, things like that. Again, when we're talking about food insecurity and nutrition insecurity, it's low income, it's low access. So, like you said, the barriers of transportation, the barriers of knowing when things are open, the barriers of things not being open when you get off work, all those types of things, as well as, having a place to store and cook and do all the things that you need to do with that food. Lots of other resources around Nevada 211, they're able to connect people as well. And then, going to your community. So whether you are part of an organization, whether that is a community center or a church, or, you do any other type of socialization, talking to people and bringing up the topic and, just kind of sharing and helping each other out, I think is really important.
Absolutely. And we have some really good organizations within the area. Places like 3 Square, they're one of the largest food distributors within the Southern Nevada area. They provide food to a lot of the local food pantries. So there might be a food pantry that's closer to you that you don't have to go to the main 3 Square office, but they have on their website lots of places that are close by that can list out what they kind of provide, what their hours are, and how to get in touch with them. There's even things like certain ones like Meals on Wheels. That's one where, depending on your age group and potentially location, they might be able to provide and get meals to you at home. There's even things like the Aftermarket, which is a part food pantry, but also a reduced price kind of grocery store area that has some good availability and helped actually fill in one of the food desert areas that was left open after, I believe it was a Walmart Supercenter left that community and took away the only access to food, and so they were able to come in and help bridge some of that gap.
Yeah, they're the only grocery store within 3 miles.
Yeah, exactly. Yeah, and there was a couple of years there that there was nothing. So really thankful for them coming in and for what they do. And even, like I said, the community area pantries, they're perfect. Places like the Center, one of our, as well as like Catholic Charities, so some of the religious organizations. There's a lot of different availability out there, and that's some of what I do. Even in my job where I work in the clinic, I help people solve their clinical problems, but having access to food is a clinical problem. And so that's part of what I do, is I just help people get into touch with some programs that maybe are close to them, because if you tell me I need to eat better, but all I have is ramen noodles, well, we got to fix that. If you're on a ramen noodle budget, how can I help you get some more fresh foods? How can we make this something that has more nutrients, something that's going to be better for you and your health goals? And
Sorry, to add on to that, I think it goes to show that food is medicine.
Yeah.
Like it's a real initiative where,
Yeah.
okay, you have certain illnesses going on.
Mm-hmm.
If you're not properly fueling to make sure that that illness doesn't get worse, or you prevent it from maybe like it going away, then you're never going to actually feel healed or be healed.
Yeah, and it's crazy that what is it? Socrates was the one that said that. So from back in the ancient philosophers in Greek, it's still held true. You know, like it's gone on for centuries. So there might be something to it, and that's part of why my role exists as a registered dietitian and nutritionist. Is my job is to help people manage those conditions through nutrition or achieve whatever their best health is. Like that could be things like weight management. So some people need to gain weight. Some people need to lose weight. Some people, we need to be talking about heart disease and how your nutrition affects that. So there's a lot of different hats that I wear depending on who it is that needs me, because I see everyone in our clinic. You're all coming to see me.
Yeah, thank you so much, Kat. And then how might people be able to access your services here at the Health District?
Yes. So I'm located in our community health center. I am able to see people that don't even have to go to our health center. But I do have to have a doctor's referral. You can't. I am a medical specialist, so there is a little barrier to seeing me. I have to have a referral from your doctor, basically saying yes, you need the extra help, and we need you to see this specialist. If you don't have that access to a doctor, come to the health center. We have that. We have those programs. We have our doctors, our providers there to be able to help people that need to be seen. And we have, whether you have insurance or not, we do have things like sliding scales based off of income to help make sure that that isn't going to be a barrier. Sometimes costs can be something as low as $20 just to be seen by a doctor. And truthfully, if you don't have the $20, still come to be seen. We won't turn you away at the door. Because again, we want our community to be healthy. That's why our organization exists, our clinic.
Absolutely. Thank you, guys. And I know we were kind of discussing Get Healthy Clark County, but are there other apps that folks can maybe download onto their phones that they can use to maybe get a little bit more active, learn about nutrition, or just learn about heart health in general?
Y'all got some apps?
We have a lot of tools on our website.
Yeah.
They're not app-based, but you can go online and you can look through our, what we call Life's Essential 8. It's a lot of infographics, a lot of articles, different charts and things like that to help educate yourself. We also have, if you are taking your blood pressure at home and you're trying to monitor that, we have blood pressure calculators, so you can input all your numbers. It'll give you the average. So, because when we talk about high blood pressure, we're talking about sustained high blood pressure. Everybody's blood pressure will kind of elevate and go up and down throughout the day, depending what you're doing, whether you're exercising versus sleeping versus taking a test. But we're looking to, manage blood pressure, like you said, on a long-term basis. We also have what's called My Life Check, where you can go in and you can put in all of your numbers. So like your blood pressure number, your blood sugar, your cholesterol numbers, and it will give you recommendations and kind of tell you a little bit like what your risk factors are for cardiovascular disease and heart disease. So there's a lot of tools out there.
Absolutely. That's why there's a lot of tools that have also been developed by the health district itself. There's the Walk Around Nevada app. So it actually shows you when you can turn it on. It'll keep track of how much you've walked, and it'll tell you literally how much you've walked around the actual state. It's pretty neat, as well as shows you areas that you can go hiking to, is some of the and walking around from Neon to Nature app. From a nutritional standpoint, there's always the My Plate app. That's actually one that's available, as well as the Half My Plate app, which is helps looking at the half of the plate that some of us dread, fruits and vegetables. And I swear to you, they're great we got to work on them. We got to show them a little love to make them something that you want to love. So and that's why it gives you some ideas there as well on how to do that and ways that we can, again, help get them in. Because sometimes those little guys are so neglected. They get so lonely on that side of the plate, and they're always left for last.
Yeah, absolutely. I definitely agree. Walk Around Nevada is a really great resource for folks. So like what Kat was saying, you can pick your different routes and you can, walk around the state. You can even walk from, I think, Lake Tahoe to like a Lake Pyramid, I think is what it was. So it's a really great app. Oh, and then Kat, what might be some heart-healthy foods that people can incorporate in their diet?
Absolutely. We won't get into the nitty-gritty because sometimes we can get a little bogged down, but on a general sense, we want to see some whole grains. They got good fiber. They've got extra iron. They help make sure that we're getting in a lot of the things that we need in our diet that we wouldn't necessarily get from a more processed white bread or white grain food. So that can be some of our whole wheat breads. Can be things like the oats. Could be things like quinoa. All of these different types of items do count. Getting a bit more of our unsaturated fats. So these ones we're more heart protective, a little more heart healthy. They are typically things like our oils, especially things like olive oil. We love to see it. It's one of the it's a gold standard for a lot of people, but even things like canola oil can still have some good benefits to it. Some getting in, especially some of our omega-3s. We'll hear that one get thrown around a lot. It's just a specific type of unsaturated fat that we've done a lot of research into. You can come from things like fatty fishes, so typically salmon. But if we start going to sushi and start dunking everything in soy sauce, we might be counteracting it a little bit. But some salmon is a good thing to incorporate. Even some of our nuts are great. They typically have a fair amount of omega-3s, especially things like walnuts, or even some of the seeds, things like flax seeds, all good sources of omega-3s. Of course, vegetables and fruit. You'll never get rid of them. They'll keep on haunting us. They're, again, good sources of fiber, but they've also got a lot of things that can help our blood pressure. So things like potassium, magnesium. They don't have a lot of salt in them naturally. So automatically they're great for you, as well as getting in some of our lean meats. So chickens, fishes, getting a variety, even our vegetable proteins. So some of our beans or even soy. If you're thinking more along the lines of some of our vegetarian proteins, and cutting back a little bit on some of the things like butter, lard, coconut oil, some of the things we call saturated fats. We know that if we get them in excess in our diet, that they can cause more heart issues than heart benefits, as well as some of the high-fat red meats or high-fat dairy, trying to cut back on them, getting a little bit less. And then, of course, limiting, not getting rid of, some of our sugar-sweetened beverages, cakes, cookies, and things. I know if I told someone, be like, we got to cut it all out, this immediately, no one wants to listen to me. But we got to just cut back a little bit. If we're drinking 3 sodas a day, maybe we can cut back to 1 soda a day. That's going to see big benefits than doing nothing at all. And that's because sometimes what it is, it's just those little changes make big results over time.
Yeah, we talk a lot about cooking because then you know what goes into the food.
Absolutely.
Like you said, less processed food. So looking at a label and seeing ingredients that you can pronounce and seeing that, there's not a paragraph of ingredients and, just very simple. You should know what's in your food and being able to look at those nutrition labels and, like you said, see the levels of sodium in there, the levels of fat, levels, how many servings are in this. We have tools on our website on how to read a nutrition label because it can be a little bit tricky.
Yes. It's like I'm the professional at it. Even sometimes I go, 1 second, let me really eyeball it. So it's something that we definitely, it's a skill to learn.
Right. It's definitely not common knowledge, although we kind of assume it is.
Yes. And sometimes that's what some of the things I go over with people is I'm just like, how comfortable are you looking at this? When we're looking at those nutrition labels, it's important. If you don't understand what the milligrams are beside everything, that's okay. There's the percentages along the side or percent daily values. They're also very important and can be maybe something that's easier to approach than having to calculate specifically all of the exact numbers that look at things, because that can be very overwhelming, and that's my job. And that's why you get to come see me. I calculate the specific numbers, but I will teach you things like the percentages and how that can be beneficial in you making choices for your health.
Right. Thank you so much, Kat. And then for our American Heart Association folks, would you be able to tell me a little bit more of the specifics of your organization, such as how your role works into managing heart health?
Sure. So the mission and values of the American Heart Association, we're here to be a relentless force for a world of longer, healthier lives. And what that means is we are interested in advancing the health and hope for everyone everywhere. Big picture, we are a research organization. We are funding research across the country. We are making sure that research gets into the hands of the providers, surgeons, dietitians, professionals that are working with the community. Our role working in the community impact aspect of the American Heart Association is working directly with those clinical and community organizations to expand their reach. So we work with a lot of the food pantries in town. We work along with the food bank. We also work with the clinics and the federally qualified health centers. So if we get an organization that says, I really want to help people control their blood pressure in our community, we can do things like come in and help them stand up a self-measured blood pressure program. Oftentimes we have different funding opportunities to, help pantries expand their work. So they would love to serve 100 more people on a Saturday, but they need 4 more refrigerators. What can we do to kind of help that? And then the education. So whether it's patient education that somebody would get in a clinic, or community education, infographics, posters, signs. We do a lot on social media. We do a lot of public service announcements. And things like that, just trying to raising awareness of heart health, raising awareness of, the benefits of learning CPR, the benefits of understanding, your health conditions, and being an advocate for yourself.
Absolutely. Thank you, ladies. So how might people be able to get involved with the American Heart Association to maybe volunteer for your program?
So we have some events that are local. So our big community-wide event that we talk about a lot is our Heart Walk. Our Heart Walk is usually in the fall. So this year the Heart Walk is going to be Saturday, October 18th at the Las Vegas Ballpark. And we are looking for both volunteers, but more importantly, we're looking for walkers. So you can join the Heart Walk as a coach, and you can build your team of family and friends. It is free to sign up. It is free to attend and be a part of the Heart Walk. And if you would like to do some fundraising for the American Heart Association, you can do that as well. It's actually the largest peer-to-peer fundraising program in the U.S. So that's pretty amazing. We do have some fundraisers throughout the year. So coming up next week, we have our Go Red for Women. That fundraiser is all about women's heart health. So only 30% of the research on heart health in the U.S. has included women in their studies. So we're trying to increase that, and we're increasing that through research grants and things of that nature, as well as just kind of raising awareness. We also have a heart ball, so we tend to have volunteers come to that as well. Also, it's a fundraising gala. But day to day, we are supporting, like I said, those local community and clinical organizations. So if somebody approaches and says, hey, I want to volunteer with the American Heart Association, we'll oftentimes connect you with those community organizations that we're supporting. So they're implementing American Heart Association programs, and sometimes they're looking for additional help with, things like health fairs and tabling, or teaching people how to take their blood pressure, or doing a nutrition class, or things like that. We're also always, open for people who want to share their stories. So we love to hear survivor stories. So whether it's a stroke survivor or a heart survivor, and a lot of times telling those stories and having people hear them makes people pay more attention, makes people feel a little bit more empowered to take care of their health or talk about heart health and stroke in their family. So you'll see we have a lot of kind of ambassadors being able to share their stories and say, kind of taking away some of the misconceptions of, oh, I'm too young to have a heart attack, or I'm too young to have a stroke. We have a couple of key volunteers who had strokes in their 30s, which, is very, very surprising. But people need to hear that, you need to know your risk factors. You need to watch your health behaviors and things like that. We also are looking for different providers, so, medical professionals who, they work in heart health, and they're willing to, talk about that, go online, go on media, and, when we're having things like Heart Month this month, go and talk about those things so that people can hear it. You're not going to learn everything about heart health in one session. You got to hear it over and over again. You're going to pick up these tidbits. You're going to learn different things about how to take care of yourself. And it's kind of a lifelong learning.
Thank you so much, ladies. And then what are some services or resources that people can have access through with your website?
So I talked first about Life's Essential 8. Like I said, that talks about a lot of different health factors. So eating, being more active, quitting tobacco, getting healthy sleep, managing your weight, controlling cholesterol, blood sugar, and managing your blood pressure. Also, our Go Red for Women website, a lot of specific information for women's heart health. So you can definitely learn a lot there. We have a whole program called Empowered to Serve, which talks about a lot of different health lessons. And these are different tools that community members can take back to their community as well. So if there is somebody who is, really passionate about heart health and they want to support the community by doing workshops in, certain spaces, we can help set you up with information on that as well. I think, being able to just be curious and go online. All of our resources are on heart.org, but definitely recommend Life's Essential 8 and Healthy for Good.
Thank you guys so much. And then what is kind of like a fun heart health that you would like to highlight for today?
A fun heart health. What do you think?
I'm trying to... Fun heart health? To be honest, the one thing that's coming to mind, just because we have the Go Red Gala for Women next Friday, I don't know if many people know, but cardiovascular disease is the number one killer for women. And I thought that was heartbreaking, but also just impactful as well, because being women, like you have a lot of stresses in your life too, So it sounds very sad and morbid, but it's true. Like, it's an impactful fact to know. So.
Absolutely, definitely agree. It really is a really important fact, especially for women out there. And then, excuse me here, do you have any other resources in other languages that folks can access through your website?
Yes, so we have a lot of different language options on our website. For some of the websites, you can toggle up on the top right between English and Spanish, and it'll translate the whole website for you. A lot of our infographics are available in other languages. Again, Spanish is the easiest one to find on our website. If there's any resource out there that you cannot find, reach out to us, and we can see if we have that translation or if we have a similar resource for you.
Thank you so much. And then just again, what website or maybe phone number can people use to access your resources?
Everything is on heart.org.
Yeah, absolutely. And then that is most of our podcast for today. So I would like to thank everyone here for joining us. And then I would also like to thank the listeners that have tuned in for today's episode covering heart health. So please check out our resources on the SNHD Health Equity page to learn more about health equity. And then please also see our resources from our American Heart Association to learn more about those cool heart facts. And then in our next episode, we will be covering the Just One Project. So this has been Grissel Oliveros with the Health Equity Chats. And please stay healthy, Clark County.